Hi, Dr. Ortiz. How do implicit biases affect how pain is treated?
Oh wow, that's such an important issue and great question. It definitely affects it, so let's talk about that. Each person's pain tolerance is different. Whether our pain tolerance is considered low or high, we rely on healthcare providers to properly analyze our pain in order to provide the best and most accurate treatment. Unfortunately, medical professionals are not immune to implicit biases, which can affect how people's pain is treated. Implicit bias is not the same as discrimination, racism, or prejudice. It's a subconscious association of characteristics based on who a person is, and it's influenced by cultural differences, the media, and personal experiences. It is important to recognize the discrepancies in the treatment of pain and how it affects people of color. For example, a 2019 study had participants who work in the medical field look at different pictures and identify which people were expressing pain on their face. It found that white participants were more ready to acknowledge pain in the pictures of white people than in the pictures of black people. What's more is that people of color are generally seen as biologically stronger than white people and experience less pain than them as well. A 2016 study found that 40% of first and second year medical students surveyed believe that black people's skin is thicker than white people's. Another study indicated that physicians were more likely to underestimate the pain of black patients relative to non-black patients. For example, if a black person says their pain level is an 8 on a scale of 1 to 10, it may be treated as only a 5 due to medical professionals underestimating what their patients are telling them. In addition, when treating pain, people of color generally receive lower doses of analgesics or painkillers within emergency rooms and post-operative settings. Of course, pain isn't always associated with a specific injury that is visible to the eye, like the pain that often comes with rheumatoid arthritis. Fixing these discrepancies begins with education. Healthcare providers can work to understand their own biases in order to better treat pain in patients of color. This can be done through educational programs at the institutional level, as well as thorough examination of one's own implicit biases. These are critical steps to creating a more equitable healthcare system for all.